Tolnaftate is a medication used to treat skin infections like athlete's foot, jock itch, and ringworm. It is an antifungal that works by stopping the growth of fungus. Some forms of Tolnaftate can also be used to prevent athlete's foot from returning. It is recommended to apply the Odor Control Foot-Sneaker 1% topical spray powder to the affected area once or twice a day, or as directed by your doctor. It is best to apply it at the same time each day to help you remember. Make sure to continue using this medication for the full time prescribed, even if symptoms disappear after a few days. This will help prevent the infection from returning. Make sure to only use this medication on the skin and make sure the area is clean and dry before applying. You can use this medication twice a day, or as directed by your doctor or the product package. The amount and length of treatment will depend on the type of infection you have. Some forms of this medication, like the powder, need to be shaken before applying. Apply enough medication to cover the affected area and some of the surrounding skin, then wash your hands. Do not wrap, cover, or bandage the area unless directed by your doctor. Remember not to apply this medication in the eyes, nose, mouth, or vagina. Use it regularly at the same time each day to get the most benefit from it. Keep using it until the full prescribed amount is finished, even if your symptoms disappear. If you have jock itch, tell your doctor if your condition lasts after 2 weeks of treatment. For athlete's foot or ringworm, tell your doctor if it lasts after 4 weeks of treatment, or if your condition gets worse at any time. Some people may experience irritation on the skin where the medication is applied. If this irritation persists or worsens, it's important to notify your doctor or pharmacist right away. If your doctor has prescribed this medication for you, it means that they have determined that the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. While it is rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not a complete list of all possible side effects. If you notice any other effects not mentioned above, be sure to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about any side effects. You can also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects and report them to Health Canada at 1-866-234-2345. Before using Odor Control Foot-Sneaker 1% topical spray powder, make sure to inform your doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. Also, remember to inform your doctor or pharmacist about your medical history before using this medication. If you are planning to have surgery, it's important to let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used if clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also unknown if this drug passes into breast milk, so make sure to consult your doctor before breastfeeding. It's important to be aware that this product may interact with other medications you are currently taking, which could affect how well those medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial that you do not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare professional before making any changes to your medication routine. If this medication is swallowed, it may cause harm. If someone has overdosed and is experiencing serious symptoms such as passing out or having difficulty breathing, it is important to seek immediate medical attention. In the United States, residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. This medication is for your use only and should not be shared with others. It has been prescribed specifically for your current condition and should not be used for any other infection unless instructed by your doctor. If you forget to use this medication, use it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and continue with your regular schedule. Do not use a double dose to make up for the missed one. Make sure to store the Odor Control Foot-Sneaker 1% topical spray powder at room temperature and away from children and pets. Do not flush the medication down the toilet or pour it into a drain. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.